Hello everyone and welcome to today's iJet and AXA webinar, Top Concerns Often Overlooked for Study Abroad Students. My name is Tina Hinchman, Senior Director of Partner Engagement and Development for Powered by iJet, and I will be moderating today's webinar. Today's presentation discusses study abroad programs and how they provide students at various levels of education the opportunity to obtain life-enhancing experiences through cultural, political, and hands-on training engagements. These experiences are generally enjoyable and fulfilling, but sometimes unprepared students and their families have a less than rewarding engagement. During the webinar, we will explore often overlooked challenges that might impair the educational experience and provide measures to mitigate and prevent these experiences from deterioration. Topics that we will cover today include medical preparedness, mental health issues, acculturation, security concerns, and participants will gain an elevated awareness about how to avoid expensive repatriation and discouragement. Before we dive into today's presentation, I have a few housekeeping items to cover. Please note that we have muted the audio for all attendees. If you have any questions, please use the chat feature in the GoToWebinar control panel at the right-hand side of your screen. We will leave time at the end of this webinar for a Q&A session with our speakers. Please type your questions into the chat feature and our presenters will answer them live for the group. We're recording this webinar and we will email a direct link to all participants following the presentation. And with that, I'm going to introduce today's co-presenters. Catherine Harmon serves as iJet's Senior Director of Category Intelligence. Health, one of iJet's subject matter categories, has long been her domain of expertise. Prior to joining iJet in 2010, Catherine practiced medicine as a physician assistant at Savannah River Nuclear Site. She provided occupational medicine and health, as well as counseling for over 12,000 employees in a high-hazard environment. She has also worked as an air traffic controller. She has experience with security vulnerability assessments for various public and private organizations, and Catherine's undergraduate education is in criminal justice. Cassie Brinkley joined AXA Assistance USA in 2012 with more than 20 years of experience in the global assistance industry. Specializing in financial services, travel, healthcare, and concierge markets, she leads AXA's service delivery function, providing 24/7 customer service and medical assistance to domestic and international insurance companies, credit card issuers, payment networks, governmental organizations, and multinational corporations. She holds a BA in Communications from the University of Georgia. Now with that, I will turn it over to Catherine, who will be leading the presentation.
Great. Thank you very much, and thank you everyone for joining us today. What we would like to do is go through some issues that we have found students have faced when they do study abroad. We'll suggest some mitigation and prevention measures for creating a more fulfilling experience. And Cassie will relate a lot of real-life experiences and events that have occurred when people have been less than prepared, so that you can get an idea of what to do before somebody goes on a study abroad excursion. So one of the biggest things is a pre-trip medical consultation, which is very important for a number of reasons. You need to find a provider that specializes in travel medicine or is at least well-versed in the various endemic health risks and immunizations that are required for travel and study abroad. Childhood vaccinations, are they complete? We're living in an era where many additional medications and vaccinations are coming on the market and are recommended for a lot of students. However, some of the older students or some who just have not been exposed to a lot of these vaccines may not realize that they're not up to date in all of the things that are recommended. So whereas a newborn is coming in and receiving a plethora of different immunizations to fulfill their school obligations, for elementary school, some of the college-age students may have missed things like the hepatitis A vaccine or the chickenpox vaccine. And when they go to emerging and developing countries, they may be increasingly exposed to these diseases, which are routine in places that have a less than optimal national vaccination program or rate. There are specialty vaccines as well, and these need to be discussed with a provider to find out what the individual risk benefit is. Some underlying conditions may preclude acceptance of these vaccines, like yellow fever or some of the others, that may interact with medication that has been prescribed or underlying health conditions. They may also be going to an area where the country may be deemed at risk for some of these diseases or illnesses, but the actual location in which they're going and their operational environment may not necessitate actually getting vaccinated. So this is something that you really need to discuss with an individual medical provider and someone who understands the the need for these immunizations and see if they're right for you. Traveling with medication can be tricky too. A lot of our college-age students are on ADD and ADHD drugs, which may be very difficult to procure in some locations. They may be traveling with anti-anxiety medication or other prescriptions that will not be allowed for entry. So Cassie, what sort of information might you need to bring your prescriptions into a new country?
So it's very important that you have a written prescription from your doctor back home in the event that you end up in a situation where you're trying to refill that medication when you're abroad. And it is helpful to do some research in advance to make sure the medications that a student might be generally taken are either available or possibly even legal in the countries that they're going to.
Great, thank you very much. That's really important to understand. Other things that may be important are the differences in medical infrastructure when you travel abroad. What you're used to back home in the way hospitals are set up and their doctor's offices and urgent care centers may not translate the same way when you're in a new country. Oftentimes, many countries have a specific structure. They have primary care facilities, which are your general practitioners, secondary care facilities, which are a little bit more specialized, and then the tertiary facilities are extremely large hospitals that encompass a lot of the diagnostic tools that we take for granted, as standalone facilities, or they're 3,000, 4,000 bed hospitals, which can be a little daunting if you're not used to seeing some things like that. So understanding, what the availability and the access is can be very important to feeling comfortable when you're traveling abroad. There are other things that students need, and especially, insurance that will cover expenses should they become ill or injured. Cassie, can you talk a little bit about coverage in other countries?
Sure. I think really the most important thing for people to do is to make sure they become familiar with what their policy covers before they leave for their trip, because policy coverages do vary. So what we recommend is that you make sure you're covered for medical emergencies, including evacuations, and an evacuation will get you from the place of an incident to the nearest appropriate medical facility for the student or faculty member to be treated. You should also get coverage for repatriations, which provides coverage for you to actually return home after an incident. It's important to consider coverage for pre-existing conditions, mental health coverage, particularly for student populations, and it's always important to see if your policy covers you for return home due to family emergencies as well as political and natural disasters.
Yes, thank you very much for informing us about all those different nuances, within each insurance policy. You have to remember that what you have at home, may not be covered, and many places expect cash payment up front. There are some hospitals that will even refuse to release you as a patient unless you've paid the balance of your stay in full. One of the biggest things to avoid even being a patient is to understand where you're going and the risks and what you can do to prevent those risks. So researching your destination is very important. It's also important not to become complacent or overconfident. There are many times where people, have been to a place before and nothing happened, and so they believe that they can go back there again and not risk any kind of exposure. We see this a lot in areas of malaria endemicity, where there is a lot of specific types of malaria. People may have grown up in these locations, they're removed for several years, and then they go back to visit and think that they're not going to be exposed to this disease again, and oftentimes they are, and that can lead to tragic consequences. So, understanding the differences in the places that you're going to be going, as we mentioned, is very important. And that's not just, specifically with illnesses and disease. It can also translate into mental health issues. So, Cassie, I think you have a good example here, to let our audience know what can happen for people, who may not be able to get their medications or stay well prepared.
Yes. In addition to understanding your policy, we definitely recommend that you understand how to reach your assistance provider, who can often help a parent, student, or faculty member navigate through a really stressful situation. We recently handled a case that involved a semester at sea program near Africa, where a young student with a previously well-controlled manic disorder became disturbed while they were on the ship. The ship was days away from the nearest port, and the doctor on board really had limited ability to treat the patient. So they were able to contact their assistance company, who worked with their insurer, to ensure that as soon as the ship arrived at port, there was an immediate escorted air ambulance evacuation for the student, and they were actually able to return back home to get the appropriate treatment they needed then. And this is a very difficult situation to navigate if you don't have experienced people helping you with it.
Yes, that's a very good point. These things can be very frightening, whether they're mental health issues or illnesses and diseases. When your child is away from you or you're away from your parents and you're faced with a very stressful situation, it's always nice to know that someone who speaks your language and understands your culture, can be there to help you through that and make sure that you get the right care necessary. So mental health issues are one of the top reasons for repatriation of both, employees, workers, and students when they go abroad. And this can happen for many different reasons. There are often pre-existing challenges, and then there's exacerbation of chronic disorders as well as new onset of diseases, especially in the college population, where they're at a juncture in their lives, and experiencing many new things for the first time. Variations in laws and regulations, away from the home country can also be challenging. There are many areas of the world where mental health is just not viewed like it is, at the person's home, and it may not be as accepted, or there may be a social stigma associated with some of these things, or not even recognized. So it's important to understand if you have a pre-existing challenge or may be at risk for any of these things, to have a support system in place. So Cassie, in the cultural differences in mental health, touching on some of these challenges and conditions, as you just mentioned, you had one student that needed assistance because of a manic disorder, and I'm sure that there are others, situations that may come up that may require telecounseling or assistance.
Yes, and it's important to realize that sometimes these situations come up and they have nothing to do with a pre-existing condition or even the activity of the child. It's something unrelated. we had a terrible case that we managed where we needed to get counseling for a group of students who were in Japan and witnessed the sudden death of their fellow student who was trying to take a picture and ended up being killed by a train. The rest of the students were safe, but they would have had a very difficult time dealing with this kind of situation while they're away from home and they don't have the support system they're used to of their family and friends, and may not even have direct access to people speaking their native language. So in this case, we were able to get English-speaking counselors available to the students really quickly, and additionally, because the insurance policy covered this kind of benefit, the students and the faculty and other people involved didn't have to worry about how they were going to pay for it, because we were able to just place a guarantee with the counseling service. But there are many things you can plan for and some things you really can't plan for. So I would just stress the importance of making sure you have a good policy that you understand well and are prepared to connect with an assistance company if something unexpected arises.
Yes, that's a very good point again. No amount of research, or preparation can really thwart any sort of tragic event like that, and it's very unfortunate, that these things happen. But knowing what you can do afterwards, to be able to assist the students who may have witnessed or been party to some sort of trauma or tragedy can be very helpful in helping them recover emotionally from these types of events. Okay. There are other security issues that are often related to health. When you leave one of your home states, or say for instance the United States, where the drinking age is 21, and you go to many other countries, all of a sudden these students are faced with new freedoms that they may want to explore and may be perfectly legal in the area where they are, to do so. Alcohol is often problematic in the younger set. The reason we have a 21-year-old drinking age is just because of cognitive development and emotional maturity and being able to make good decisions. And it's not saying that 18 or 19-year-olds can't make good decisions. It's often just when they're faced, with some of these freedoms, they're not quite sure how to handle it if they haven't been previously exposed or counseled, to what is recommended or good guidance. 18-year-old drinking ages can, be fraught with binge drinking or not necessarily responsible alcohol use. So these things need to be discussed in advance because you know that they're going to be faced with these temptations and they need to know how to handle themselves. Don't assume that it's not going to happen. There are some areas, too, where alcohol is absolutely forbidden or is against a societal norm, and consuming that, can put the student at risk for a social stigma or even breaking the law, and so they need to know those, too. In addition to alcohol use, often public displays of affection between members of the same sex or even between different genders is often frowned upon. Even holding hands or kissing in public can be seen as an affront to a religious or a social norm. Students need to know this ahead of time so that they don't step into a sticky situation, where they are getting berated or even arrested for such displays. LGBT norms vary, and there may be restrictions or even criminalized penalties, for some of these groups. And they need to be students need to be made aware of this before they travel so that they'll understand how to behave, and that when they're in another country, their local laws don't follow them. Recently in the news, we had a group of students who were arrested in another country for what would be seemingly deemed a very minor infraction in the United States, and they were faced with staunch criminal penalties. If they maybe had understood, and had done their research ahead of time, they could have avoided the situation, and then it wouldn't have become almost an international incident. So understanding that local laws vary, even littering laws or traffic laws, and they could come with very stiff consequences, will really help understand, when to rein in certain behaviors or when more freedom is going to be presented.
Yeah, and Catherine, I would just add to that even sometimes when a student is well prepared, very responsible, and really completely comfortable in their surroundings, something really unfortunate can happen, and a student will need the help and support. We assisted a student not too long ago who was studying in Turkey. She felt completely secure and comfortable with her surroundings, but unfortunately, she was sexually assaulted while spending a day at the beach and had to be taken to the hospital for care. She had options for local and remote counseling, and additionally through her good policy coverage, she was able to connect to the medical team back in the U.S. who worked with her caregivers at the hospital in Turkey. They discovered that she was allergic to a medication that she was getting and was in danger of having a very bad reaction. So they continued to, the U.S. medical team continued to work with the Turkey medical team to get a appropriate alternative medication for her. And then in the end, she did need to be repatriated back home due to just obvious mental trauma, and was in the fortunate position of having a policy that was able to cover that for her and get her back home.
Yes, that's very good that she was able, to be brought back home successfully. As we have said before, and these excellent case examples illustrate, repatriation for mental health challenges and issues is very common. It's hard to anticipate such a need, but it's nice to know that this is an option, if a student gets into a situation, where they just can't tolerate where they are any longer. Acculturation can often add to the needs for repatriation. Feeling homesick is very, very common. This can be without a pre-existing condition and outside of trauma. A lot of distress can occur when a child or a young adult is homesick and there is no intervention. Once a novelty of a new place wears off, students are left with the reality that this is their life for the next several months, and it can be very challenging coming to an acceptance of things like no cable or no internet, spotty phone service. Social expectations may be very different than what they experience at home, and they often have a sense of feeling lost or out of place.
Yeah, I would add also, Catherine, that you can't really know in advance how your student is going to react to a situation where they're away from home for an extended period of time. You can do everything you can do to help prepare, and then sometimes something unexpected still happens. We had a recent experience with a student that was really the opposite of the problem we're describing here. They actually became depressed because they didn't want to leave their study abroad program and return home. It became serious quite quickly, and the student became suicidal and had to be involuntarily admitted for treatment. And compounding that problem was that because the student program had really already ended, she was in danger of being quickly deported. So we were able to get her evacuated to Finland, which has similar psychiatric care to the U.S., until we were able to send medical escorts to get her on a commercial flight back home for readmission into a U.S. facility near her family. But you really can't necessarily know how a student is going to react, so your best bet is really to try and do as much research as you can in advance and just try and stay close to whatever you need to reach back out for help from your assistance company or your insurer to make sure that you're prepared for whatever might happen.
Yes, that's an excellent illustration of things that may be often overlooked or concerns that may be not taken into consideration is, what happens when they don't want to come home because they are so used to their new environment or they've made such close associations with friends and a host family. That's a very difficult situation for both the student and the parents to understand and be able to reconcile. So again, having someone on hand that understands the space and understands exactly what is needed and what will provide the best result is extremely important. So this isn't to say that all study abroad is doomed for failure. In fact, the opposite is true. Being proactive, doing a lot of research ahead of time can thwart many of these challenges and make a successful experience. And having the proper mechanisms in place for if something does occur can also lend a feeling of comfort for both the students and the parents when they choose to leave their homes for a number of months in order to increase their social experiences and their social consciousness, as well as further their education. Okay. So Cassie, as you have very excellently illustrated a lot of these case examples, we understand that some issues are unavoidable, but when they do happen, then having that support network in place is extremely important for a successful conclusion of their study abroad experience.
Yes, I agree entirely, and would just reiterate to make sure that students and parents and faculty understand their policies in advance, that they understand how to reach their assistance provider, who not only can be a lifeline in an emergency situation, but can also help with day-to-day issues around needing routine medical treatment because a student has a mild problem. And just one last thing for people to keep in mind, it's common for students to extend their trips to travel around the company after their study abroad program ends. And keep in mind that generally your coverage ends at the same time the program does. So students and parents, if they're planning on extending travel beyond the study time frame, should make sure that they get a separate travel insurance policy or something to make sure their coverage is also extended.
Yeah, thank you for calling that out. They often want to take advantage of the time that they have in a country to see, landmarks or ecotourism and experience a lot of things that the curious mind, will lead them to. That's often fraught with some dangers if they don't do their research ahead of time, and they certainly want to make sure that they're covered for any event.
Okay, great. Thank you, Catherine and Cassie, for sharing your expertise with us. Now I'm going to open the floor to questions from attendees. Please remember to type your questions for Catherine or Cassie in the chat feature on the right-hand side of your screen. Okay, so Catherine, you mentioned researching the destination and other important things to consider, but where can I go to find this information to prepare my child for study?
That's a good question. There are many different types of websites and forums that can, answer specific questions if you ask them in. Going for medical preparedness and just sort of getting an idea from the US CDC websites, which have, a very excellent traveler health section, as well as the United Kingdom's Travel Health Pro, can also answer quite a few questions, or more importantly, help you articulate some of those questions when you do seek medical pre-trip consultation with a provider, experienced in this space. Oftentimes people go and they just don't know what to ask. They're very confused by the whole thing, and there's a lot of information that's out there. Some of it often conflicts. So, understanding what are the good questions to ask and feeling comfortable asking those questions will lead for a better experience. Additionally, the U.S. Department of State has excellent country pages up to be informed about non-health issues, and enrollment in the STEP program, which is just letting the State Department know where you're going to be and when you're going to be there so they can send you important notices. But your assistance providers can also help you in answering some questions and getting you the information you need in order to prepare for a successful trip.
Okay, thank you. And Cassie, I think we touched on this lightly earlier in the presentation, but we have a question here about medications. So students that are traveling abroad, if they bring their prescriptions and medications with them, can you provide some insight and expertise on how to manage prescription medications?
Sure. We did talk earlier about the fact that sometimes the medication they need may not even be available in their country or in the country they're visiting, or could even be illegal. So we recommend before leaving home that a student obtain a signed prescription from their doctor that contains both the generic and the brand name of their medication. It's also helpful for them to get a letter from the doctor that outlines the recommended dosages, particularly for injectable medications or controlled substances, because that will really help if they get in a situation where they need to deal with a local provider in the country they're visiting. And then finally, students who have a history of medical issues may also want to ask their doctor for a letter that outlines their diagnosis and treatment. So if they find themselves in a situation where they're dealing with a doctor who doesn't know them in their visiting country, that they'll at least have a letter from their home doctor that will give the treating physician some clues around what's going on with them and really the way they should proceed. So the better you can sort of connect with your home doctor in advance and make sure you have plenty of documentation, the smoother it will go.
Yeah, and I would imagine it would also be helpful for them to have copies of all of these letters and prescriptions, and at least one additional copy with somebody at home so that if they have to get it, they have it accessible.
Yeah, absolutely.
And Catherine, here's another one for you. If my child runs into trouble, can't they just go to the embassy? Isn't that what they're there for?
Well, not all embassies are available in all locations, and actually, a country embassy is there to assist, citizens of that country, but it shouldn't be used as a crutch, and they're not completely responsible, for the activities and actions that your child may take when they're studying abroad. So certainly, if there is a large-scale security issue, they can seek counsel there. If they lose their passport, that's, what the embassies, will help them navigate through the process of obtaining a new one. But certainly, if there are some acculturation issues or social problems, or even, a misstep into a criminal offense that they may not understand, could be facing them, then no, the consulate, is there for a lot of other things, and they may not be able to provide assistance or, definitely not immediate assistance. So understanding what those restrictions are and understanding, who they can go to for help in certain situations is very important, so they don't find themselves in the middle of an event and then realize, at that point that they're not going to get the help that they need as fast as they may think they require it.
Okay, that's good advice. Cassie, it looks like we have one other final question here that's come through. When you have situations where students and faculty may need a medical assistance and they arrive and then they've been asked to pay out of pocket if the medical facility doesn't accept insurance, do you have any recommendations for how to better handle these situations?
Sure, I do. This is actually one of the most common services that an assistance company provides. the key is to try to always reach out to your assistance provider before you seek medical treatment, if you can, if it's not an emergency situation, because your assistance provider can usually connect you with a local provider who will accept a guarantee of payment. So they won't ask the student or faculty member for cash on the spot. They will accept a guarantee from the assistance company. And additionally, if you're able to reach out to your assistance provider in advance, they can also help steer you to an appropriate provider who may speak your native language and who has otherwise been vetted to make sure their treatment they're going to provide is appropriate. If you do find yourself already at a facility because of an emergency or some other reason, even then you should try to reach out to your assistance company, because they will do their best to work with that particular provider and ask them to accept a guarantee of coverage so that you don't have to pay cash out of pocket. It doesn't always work depending on where you are, so in the best possible case, you try and connect with your provider in advance.
Okay, great. Thank you. Do we have any other questions from the audience? Okay, it doesn't look like it. So with that, we're at the end of our questions, and we're going to go ahead and wrap up. Catherine and Cassie, thank you for your time. Today's webinar is part of our co-branded iJet and AXA three-part series, Navigating Risk. Are you prepared for the unexpected? We will email registration information about our third webinar, the 2018 Health Outlook, which will be presented on December the 7th. Thank you again for your time, and goodbye.
Thank you.
Thank you. Bye-bye.